Hi everyone, welcome back. And so today's video is actually going to be sort of come in two parts. I am in this video going to be talking about hypothyroidism or an underactive thyroid and how massage may help with that. And then I'm going to do a follow-up video on hyperthyroidism, which is an overactive thyroid. Hypothyroidism, it affects around 0.1% of the population and causes increased fatigue, metabolic problems due to the body's inability to produce energy. It happens as a result of either thyroxine levels being abnormally low or due to the target cells becoming resistant to the thyroxine. Now, the thyroid glands, I will show you a picture. So the thyroid gland basically sits around the trachea, as you can see in this picture, and it is responsible for secreting two hormones. So the two hormones that it secretes are thyroxine, otherwise known as T4, and triiodothyronine, sometimes just called thyrine, which is known as T3. Now, both of these hormones are responsible for controlling the metabolism. Thyroxine tends to be secreted in higher levels, but the thyrine is more potent. Now, the thyroid is controlled by the pituitary gland, which secretes TSH, or thyroid stimulating hormone, which obviously then is responsible for releasing these two hormones. Now, the higher the thyroxine level, the faster the metabolism, and we'll talk about that when I do the video on overactive thyroid. So basically, when levels are low, the metabolism slows down. This can cause fatigue, weight gain, and hypersensitivity to the cold, all of which, you know, classic symptoms of hypothyroidism. Other obvious indicators of an underactive thyroid include a goiter, slow heart rate, and also slow reflexes. And also, if hypothyroidism occurs during pregnancy, this can actually result in mental retardation and poor growth, hence why thyroid levels are one of the things routinely checked during pregnancy. Now, what are the risk factors for an underactive thyroid? Well, hypothyroidism tends to affect around 5 times as many women as it does men, and also up to 10% of women over the age of 65 are affected with this. Now, there are some suggested causes. Research has shown that hypothyroidism may be related to general toxicity, cellular resistance to the thyroid hormones, so the hormones are still being released, but those target cells are resistant to the hormones. Or it may also be related to T4, which is thyroxine supplementation, rather than T3, which is the thyrine. So what are the signs and symptoms of hypothyroidism. Okay, so here you can see some of the signs and symptoms of an underactive thyroid, and as you can see, it can affect someone both physiologically and psychologically, and affects, you know, pretty much all of the systems of the body. Now, some of these symptoms are more common than others. So the most common symptoms with an underactive thyroid certainly are fatigue, weight gain, depression, sluggish digestion and constipation, hypersensitivity to the cold, sometimes quite puffy, dry skin, brittle hair, possibly even hair loss. Periods can be very long and heavy, and of course we have the goiter, which if you don't know what that is, then take a look at this picture. So a goiter is basically where you get this very noticeable swelling around the neck, which is basically where the thyroid gland has become inflamed. Now, there are some commonly associated conditions with an underactive thyroid and complications of having an underactive thyroid. So these include things like atherosclerosis, which obviously is where you get plaque build up, particularly in the arteries of the lower legs, which can there can be a tendency to throw off bits of plaque during a massage, so that's definitely something you need to be aware of, and your therapist needs to be aware of, because it means that you can only use a couple of specific techniques, which not all massage therapists do. This atherosclerosis, quite often in sort of people without thyroid issues, it would be due to things like high cholesterol, but it may be due to sluggish liver function, meaning that there are reduced chemicals that basically process the cholesterol. One thing to note is that hypothyroidism that is related to high cholesterol doesn't tend to respond to medication. Another complication is carpal tunnel syndrome, which often happens due to retention of fluid around the arms and the wrists. There may be chronic hoarseness in the voice, which may be due to that goiter, that swelling in the neck, or potentially due to fluid retention in the neck. Possibly loss of consciousness in severe cases, which is called a myxedema coma, and this will happen in severe cases due to cold and fatigue. Other associated conditions may include fibromyalgia, chronic fatigue syndrome, depression, and also thrush. Now, diagnosis may be difficult due to the number of symptoms that cross over, you know, into these other conditions that are associated. But, you know, if you think if you are getting sort of excess fatigue and things, you know, it is important to just get a blood test to check your thyroid levels. Now, in terms of treatment for an underactive thyroid, really it's going to be thyroid hormone supplementation. That is the treatment. However, massage can help in some ways. So it won't help to obviously balance out the levels of the thyroid hormones, but You know, it can work alongside that medication to just generally help improve quality of life, help to increase energy levels and reduce that fatigue by basically improving oxygenation to the tissues. It can help to just offset the reduced hormone production by increasing the blood and lymphatic circulation. It may work on the digestive system by improving peristalsis, and therefore it can help to reduce the bloating and constipation if that's an issue. We know that massage can help ease depression and anxiety by lowering those stress hormones and increasing endorphin release. And you know, as we mentioned there, if atherosclerosis is a problem, massage may still be possible, but if this is the case, only see a therapist who is really experienced in dealing with atherosclerosis, who has knowledge. Ideally, you do want a massage therapist with a medical background, because your average massage therapist is not going to know probably what atherosclerosis even is, let alone how they should treat it or what techniques to use or avoid. And obviously, you know, the last thing you want is, as I say, to throw off some of that plaque in the artery, which of course could then have, you know, really serious consequences. So do keep that in mind. But so that's really an underactive thyroid in a nutshell. I am going to also be putting up next a video talking about an overactive thyroid. And you can see also any of my other videos or get notified when new videos come out by subscribing to my channel. If you've got any questions or comments, do feel free to leave a comment down below, or you can contact me through my Facebook or Instagram. I'm on there as the Medical Massage Lady, and I will answer you, you know, if you have any questions. But for the underactive thyroid, that is all from me. So I'll see you next time.